Surely the Ministry of Health capping the price of medicines is a good thing. Certainly if we consider a country with high unemployment, high inequality, and high levels of poverty, this should be welcomed or seen as a good move, no?
Yes. Yes and no. I think yes in the context of it's good that the pricing is not going to be raised beyond the 4.53%. But beyond that, I think there's a lot more that needs to be done by the ministry and the sector. Because in this case, although there's an inflation-linked potential raise in pricing, and government has what it normally has is a single exit pricing, a lot more needs to be done. Because this only regulates pricing of drugs that are in the country. It doesn't regulate the opportunities that we have as a country and as a continent that still remain available to the country that's not being used and or exploited as yet.
Okay, so this refers to medicines that are already in the country, as in we have stock of it currently in the country or they're produced in the country?
My understanding is produced and or stock in the country, but it does not refer to the equivalent and or similar products that are available at a fraction of the cost internationally by suppliers like India, Europe, Canada, etc.
So those products would still be determined, well, their price would still be determined in whichever market that we are buying them from. So for instance, if we're buying PrEP or if we're buying ARVs or whatever medicines from another country, we won't be able to determine or implement that 4.5% cap, is what you're saying?
No. Maybe just a quick context of how the industry works. To sell any product in this country, you need to go through what used to be called the Old Medicines Control Council, now known as SAHPRA, the South African Health Product Regulatory Authority. That requires a lengthy and, in my mind, almost unnecessary dossier process. My understanding is the process has got faster, but it used to take, historically, up to 3 years to register each product. So say, for example, a product is manufactured by a pharma company in India that supplies Europe and the United States, and it's licensed and approved by the FDA, which is the Food and Drug Administration Agency. Usually one of the strictest regulators is the FDA. South Africa says, we will retest your product. You need to send us dossiers and processes, and instead of processing it quickly, we put you in a queue. So you could wait 3 to 5 years, and there's a lot of political meddling and a whole load of industry meddling to try and reduce the opportunities of these suppliers. I travel regularly to India and other countries where you can get drugs that are 5% or 3% of the cost of what it retails here. You could buy retail in India and elsewhere, but the product just won't get here because the local pharma companies won't allow it. Neither will those who have vested interest in keeping prices high where they are. So the reality is you could get medicine at a fraction of the cost. The country has not chosen to allow those products in. So they call it regulation, they call it control, but the reality is there are multiple multinationals who bring their products in to the country that currently supply in South Africa that don't allow other products into the country at a fraction of the cost, knowing the disease burden that we have.
And is this a decision as a result of unlawful or untested medicines in the sector? Why have we chosen what sounds as if it's the more difficult route, the longer route, the more expensive route?
I don't know would be the correct answer. I don't know why the decisions are made. I can only speculate that there's, various vested interests, as is in any industry. But the reality is, a lot of these products, I flew with the presidential delegation in 2010 when then President Zuma flew from South Africa as the first state visit in his term. And there were massive lobby groups that from the pharma side came with the delegation to India that were there specifically to block meetings and not allow them to happen so that these international suppliers don't get you. These are not inferior products. These are mainstream products that are sold in the US, Canada, and Europe that have far stricter controls than we have in terms of our market. The reality is we may have a strong regulatory policy and process, but we're not the largest consumer market in the world. If the largest consumer markets that are highly more sophisticated are happy with these products by these companies, who are we to say no, except those who have a vested commercial interest? I've seen products, for example, in the pain space, where you would find muscle relaxants, combined with anti-inflammatories and paracetamol, which is your Panado, which would retail for less than R1 or 2, which you wouldn't get in this country. The muscle relaxants in this country would be north of factors of 10 or 20 of those pricing. Internationally, these are combination pills. South Africa doesn't want combination pills because it's against the interest of those retailing. They'd rather you buy 5 tablets to solve one thing as opposed to buying one combination pill at a 5% cost internationally, because of that is how the system is built. I think a lot needs to happen. A lot has been done. The regulator has obviously changed name. There's new processes, but it's way too slow for my thinking. There needs to be a collaborative effort, almost as such as the way we recognize marriages. If one country says you're married and we have proof and we can document that it's been done, the process needs to follow through. You don't need to retest every product if it's been tested by an agency that you know and trust, and you build a collaborative relationship with the US FDA, the American equivalents, the European equivalents and the Canadian equivalents, because these products are out there in volumes that we have never seen in our lives. But there just is an unwillingness at this stage for factors unknown to me why we don't bring these in. So there is a big benefit of locking in the private industry for this moment for a single exit pricing, but it hasn't opened the opportunity for the farmers internationally. Because I get calls and engagement from colleagues internationally who say, we want to bring your products to the country. And my answer is it's going to take you 18 months to 3 years to